I'm going to do questions from here, I think. So we now have time for questions. Just a reminder that the number there is 0409 606 350, and I think they're going to bring the first question up any second now. There we go. So this is a question for anybody up here to answer. The manslaughter charge, is there retrospectivity and does it cover chronic disease exposures? I don't need to, you can read that, right? Who wants to take this?
My understanding, and I haven't seen the detail of the bill, but I'm not sure it would be retrospective. That would be highly unusual. I think the Minister did talk about the link to disease and illness. So absolutely the government is clear that the proposed bill going through the Parliament, the aim would be that it is absolutely also associated with silicosis or any other disease or illness as well if it results in the death of a worker.
Yep.
Yeah, that's right.
All right. So, on that theme, we have a question here, which is about, we're working towards workplace manslaughter, but what about stronger penalties for just generally providing unsafe work sites? Because not all serious injuries or accidents cause death.
So the government did increase the penalties currently, and of course the penalties are issued by the courts. In the last few years, in my time in this role, we've seen a significant increase in penalties and fines being issued by the courts. In the last 2 years, some of the highest penalties. It was interesting to reflect on penalties for the death of a worker that Luke spoke about, and we've also seen fines in the last couple of years of in excess of $1 million being issued by the courts. So I think that that's something that we monitor pretty closely, and it's an ongoing conversation obviously around the interpretation of the law and how the courts issue those penalties. But I think that they certainly do send a very clear message.
Anyone else? Oh.
I think that's right.
Yeah.
All right, so this question is, what advice do you have for employers where employers repeatedly breach the Act by making changes without consultation? The marked up Act we were given today suggests a PIN notice. I think, Daniel, you might have a view about this.
Yeah, I've had a lot of good results from PIN notices. Sometimes they're the only way to get things done, to be honest, and management don't always listen. It's always the first PIN that's the hardest one to issue, and things change after that. Management take you differently after that, and it doesn't always end peacefully. Sometimes I've had to change a PIN, like I've had to extend the compliance date on it, but usually it's gone all right. Yeah, that's probably about it.
I was going to say, we're very interested in workplaces that continually are not consulting as per the legislation. So if I agree with Daniel, obviously absolutely use a PIN notice, but if you're having to use that consistently, I think it would be also appropriate to give us a call. As I said, it's a bit of a focus for us at the moment. We think this is a core requirement of good health and safety management in the workplace, and so we are interested if there are workplaces that are not consulting as per the legislation. We're more than happy to see if we can send someone out to have a conversation.
And lastly, I'd add, call your union, get your workmates together, see if you can take some action, and then call Trades Hall as well.
Someone's very quickly texted in response to that. I think this might be in response to your answer there, Daniel. After you've chatted to management and you've consulted a few times, if the issue remains, at what point can you start issuing PINs?
What I usually do is speak to management. After I've consulted, I'll let them know if the issue's not fixed, say by the end of the week, I'll be issuing a PIN on it. That's the way I usually go about it. Quite often now they fix it before the end of the week because they know where it's going to lead, and it often fixes the problem before issuing the PIN.
Yep. All right, I think this might be something that's a bit universal for HSRs, which is how do they get more time to talk to people on the shop floor about the issues that are coming up and about workplace health and safety issues?
What do you currently do?
My union organiser gives me a lot of help there. When he comes in, he speaks to management and he calls me off the floor and we conduct our meetings there, and management have been pretty okay with that.
Different workplaces operate differently, so this question will apply, somewhat, you'll have your own ways to do this, but some people will do briefings before shifts, some people will take time off during the lunch period, some people talk to the employer and say, hey, we've got to have a chat, we're going to stop work for a period of time and have a discussion about health and safety because you haven't done it. So whatever works for you, but if your employer is pushing you back from talking to each other about, keeping yourself safe at work, that's definitely a time to talk to your delegate on site, also talk to your union organiser.
Yep. So this is a question around counting the numbers. How do we measure, because we always say a certain number of workers have died each year, and at the moment I understand WorkSafe isn't acknowledging workplace suicides as workplace fatalities, so I suppose there's a question about why that might be and whether that's going to change.
So there is a way that we've agreed nationally in terms of reporting fatalities in the workplace. I know there's lots of debate about that definition, not just for suicides, but I'm also aware in terms of road or transport accidents as well, when people might be in the course of work. So we are always open to a conversation about how we report fatalities. I know Trades Hall has a strong view about that, and I'll let Luke respond to that, and often does provide different data to what we provide. My role, and I presume in the future, will sit on Safe Work Australia, and it has been raised there for us to have an ongoing dialogue around how we capture all workplace deaths in terms of our data. But at the moment it is not included in the way that it's defined.
Yeah, so we do have a strong view on this, Claire is right, and we think what we only count is the bare minimum. And there's an old saying, like, you count what you care about, and for us, we care about if it's a workplace suicide, we care about it if it's on the road, and that's your job. You might be a truck driver, taxi driver, whatever, delivery driver, and we also don't count workplace diseases, and we think that's a big problem, because if we're really only saying, we're counting, it's horrible numbers still, 30 people get killed at work, some people will compare that to a road toll or something like that and say, well, is it a big enough priority? Because when those numbers are horrible, but when you count it properly, it has an effect on people who spend money to make change, on politicians. If politicians really knew the real count of death on our work sites, well then maybe they would prioritise putting more money into fixing these issues, and that's why we have such a strong view on it.
Yep. So this one seems to come up every year, which is a question about the relationship between inspectors sometimes and with management, and that sometimes it looks like inspectors aren't necessarily working with HSRs. Yeah, like I said, seems to come up every year.
It does.
So I suppose just generally, maybe, and this is one that all three of you can answer from your perspectives, what is it that our HSRs out here today can do when that looks to be the case?
I mean, we do get phone calls and complaints about that, so don't feel that you can't contact us. If you have a concern about an inspector's behaviour, you can actually contact the organisation. I think importantly, our inspectors are required to work with management and with workers and HSRs. Really, our first point of call is to make sure people are adhering to the law, but also to educate and support employers and the workplace about what they should be doing in terms of managing health and safety better. So I appreciate, and I do hear that. I also get a lot of complaints from employers that we're too friendly with workers or union representatives. So we do try to get that balance right. But if you have a consistent issue or you've got some evidence of that, you do have the right to make a complaint, and they are independently investigated. So we don't just ask the inspector's manager to do the investigation. We do investigate all complaints and we take them very seriously.
I suppose what I would be saying is that we would like directions from the people who are in charge of the inspectors to say that the first person that an inspector meets when they walk on site is the HSR. Right? And so when they meet the HSR, then they get the actual story about what's happening in that workplace. What we don't want to happen is that the HSR gets directed to meet the employer, and the employer says, "Oh, mate, there's nothing going on here, there's nothing wrong." And then the inspector has to do the work to try to untangle it. We'd like it to be the other way around. So, because, these inspectors are, union members as well, and I know we've got inspector delegates who are staunch. But the direction should be from WorkSafe, the first person you talk to is the HSR rep, and the HSR rep is going to set you right about what needs to be fixed.
I did have one such case as this before when I actually had a bit of a dispute with a WorkSafe inspector. The next time my phone WorkSafe, I asked for a supporting officer, which also come in handy too. I had two people there to express their views, and it was much more productive, I found.
There you go. All right, so this I know is one of the things that the Minister talked about, and that is an increasing issue in workplaces. Not that it's increasing, it's always been there, but we are focusing a lot more on it now. Does anyone have a view up here about how we can address workplace mental stress and fatigue?
So as I said, I think the most important thing, and I always say this in terms of health and safety, is that it's really about you know your workplace best, and the people who are doing the work will also know what key things they can do in terms of stress and fatigue in the workplace, and think differently about how to resolve those issues. And I know a number of the unions are very active in trying to work through what are better ways to perform the role, support people in the workplace, and have a different approach to what we've done for many, many years that may not be effective going forward. As I said, the Work Well toolkit, we do provide lots of tools and case studies about what other workplaces are doing. And that includes everything from workload management, shift management, breaks. So there's lots in those toolkits as well. So I encourage you to go and have a look at those. But I always start with every health and safety issue in a workplace is usually best sorted by the workers doing the job, actually talking to management and being part of the solution.
Is anyone else out there feeling pretty tired at work these days? Yeah, like exhausted at work these days? I think the nature of work has changed. So remember, we won the 8-hour day, right? 8-hour work, 8 hours rest, 8-hour recreation, or for what you choose. Now that was an important campaign, and slowly over time, and more rapidly I think recently, is that 8 hours work, that ain't 8 hours just work. Like that 8 hours work is becoming 10 hours work. Or what you're asked to do within that period of time is just so much more. So you're exhausted at the end of the day. I think the pressure of increased productivity and the pressure from management to get more done in that period of time, I think we're reaching the extreme end of that. And that's where some of the mental stress is being put on us, and that's why we're feeling fatigued. There does need to be a campaign to look at productivity and the amount of work we do and how much work we do. That's been something that the hall has been sort of debating with over the last 6 months. What does that look like? Why did we, win the 8-hour day and not go to the 7-hour day? Because at some stage we stopped, right? We said 8 was enough. So we need to start thinking about that. But I also agree with Claire that this needs to be raised as a workplace issue as well. If there's too much stress being put on that workforce will collapse for that business in a really horrible way.
I agree a lot with what Luke just said. At work, we've just gone through an EBA negotiation, and the company's biggest thing that they wanted implemented was a 10-hour working day. That's not counting your smoke-out breaks and all the rest of it. It would have worked out to 11 hours and 20 minutes. And that's working in an abattoir when you're on the chain. You can't walk off any time you like and go to the toilet. You've got to call for somebody to come and chop you out. It's not that easy. To be up there, those sorts of hours, I think is unsafe in its own. And with the support of the workers, we had that squashed. We voted that down straight away. Thank Christ. I'm stuffed if I'd want to be there for 11 hours and 20 minutes. That would certainly increase fatigue and mental stress in the workplace. Another thing is manning levels. You know, we've gone through changes there, like I spoke about before, with chain speed and manning levels. We had a big shit fight over chain speed, which I issued a pin notice on. Manning levels, we won a few extra, one if you call it one, I suppose we won a few extra slaughtermen, so that takes the stress off some of the other guys. And you can be there for longevity rather than breaking down and leaving in 6 months or 12 months, which would often be the case.
Yeah. Totally agree.
All right, so this is a question about something that's come up today, which is silicosis. So this is around concrete in particular. So at the moment, we've talked about the medical screening that's out there for people who are doing stonemasonry, so people who are using the artificial stone. But are there broader risks than that, or where are we at the moment?
Yeah, so at the moment, you're right, the health screening, we've prioritised stonemasons, but we've also been doing work across quarries in Victoria, and we are having conversations around construction, excuse me, around concrete cutting. There are risks in terms of exposure. The reason why we've targeted the Caesar stone or the fabricated stone is because it's 95% silica. So it has a much higher risk associated with how much silica is in the stone. But we are talking to all industries. And so I think we need to consider what the issues are in terms of screening.
I'll jump in.
Thanks. For all workers.
So I think this has probably come from some CFMU or AW members. If this is something you're chasing, free medical screening, if there's breakout groups or if you can contact your union organisers, let us know, because I think that's something we can fight for and probably get pretty easily. Silica is in the environment, right? It's in sand, it's in everything. But in terms of what we've prioritised first is where the most amount of risk is. But if this is something we want to extend to, we are very open to doing work in that area too. So we'd like to make that a yes.
And we'd like to hear about that as well.
So this is one about HSR rights. So this is about whether people should be getting time for undertaking their tasks as an HSR, because at the moment we've got someone who is basically using their time to complete the tasks associated.
That you're having to do that outside of work hours is how I'm interpreting that.
So
I think that's definitely worth having a conversation with your employer. Like, how much time is it taking? As I said, that you do have rights if you are an HSR rep around being able to do that role, and that the employer providing the support and the environment for you to be able to do that role. So if you're having to take work home, or that's how I think that's read, or you're working longer hours to get that done and with no pay or time in lieu, I would definitely be raising that with your employer, because you have a right to be able to conduct your role within the hours of work.
Yeah, this should be definitely done at work time. So if your boss says we haven't got space for you during work time, it's not like we're not doing the boss a favour by doing this outside of hours. No, what we're doing is we're keeping their workforce safe and healthy. That is a workplace time, that is a workplace responsibility. It's not some after-school activity which looks like this employer's trying to make happen.
Okay, so I think, I'm not Oh, has it come up? No. All right. This is maybe slightly controversial. There's a lot of conversation at the moment. I'm assuming glyphosate is Roundup in the horticultural and agricultural industry. Does WorkSafe have a view about this product? And I suppose I'll broaden it out then to say, does VTHC have a view about this product? Do you want to kick it off, Claire?
Yeah, so I think we haven't made or taken a position on banning the use of the product, but we are obviously happy again to engage if people have concerns. Again, our priority would be that workers are issued with the appropriate PPE to use any chemical or any product that they might be exposed to. So we would be focused on that the workplace is actually providing you with the appropriate equipment and particularly protective equipment for you personally to make sure that you can use that product safely.
Yeah, we're worried what we're seeing coming out of the US, and that's probably where this question has come from. There's lawsuits that are going on right now from people who have, got sick and have died from using products like Roundup. I'll have to check in with Renata, who manages at Trades Hall our chemical diseases list, to check what our current status is on that. But I'd be pretty concerned and be using extreme caution when coming into contact with it.
Can I just say, we do monitor, just when you were saying that about what's coming, so we do monitor research and we also commission research if we think that we need to have a look at something. So again, happy if Renata's got anything that you think we should be doing some deeper research or having a different conversation around, is there a safe way to use certain chemicals and what protective equipment's required, then let's maintain the conversation.
Great question.
All right, so there's a couple of questions that have come through now about HSR rights. So first off, does the HSR have the right to be present during a whole of a WorkSafe visit?
It's often met with management for okay. Yeah, and I think that's consistent with the commentary I had before. As I said, we are introducing some new tools for our inspectorate, which actually requires better detailing for us around the HSR detail at the visit. WorkSafe does have a right, obviously, to speak to both the HSR privately or the worker privately and the employer privately, usually in terms of questioning and consistency, so it actually helps an inspector truly assess what's going on. But I think that, obviously you have the right to be present for the visit, but it's appropriate that an inspector at times might separate people whilst they're trying to truly understand what's going on in that workplace as well. If they're meeting with management for hours before they actually ask for an HSR, one of the things that we've understood, and we've done some work with our inspectorate, is often they'll ask if an HSR is on site, and they might be told no, that their HSR is not on site. And I'm not saying that employer's lying, but what then we are now following up with a question is there another worker from that designated work group or that could be present during the visit? So, because we also understand that sometimes the HSR that may have contacted may not be on site. And so the interpretation is literal, so we are asking if there are other HSRs or if there is an employee or worker on site that could be part of that visit as well. So we do make sure that our inspectors ask for that.
I think this is an interesting question because it goes to perceptions on one level. If they're spending hours with management before talking to us, even though they could be talking about the football, it will still make us think that they're talking about, the issue and not dealing with it. So I suppose the first thing we would ask is that we would like WorkSafe inspectors to, get that direction from management to go meet the HSR first. I have no issue with a HSR then having a discussion with management to try to resolve stuff. That's part of the work, but I think, for sake of perceptions, that at least the HSR should have that initial conversation.
Yeah, I think if you also contact us and you've organised for the visit to occur, Lee, please give us a way that we can contact you, a number, mobile number or a number, because again, we're also encouraging that the inspector might ring you before they actually visit. So they might have a conversation with you over the phone as well. But more importantly, we are really working hard to make sure that when we've scheduled the visit, you know when we're coming. So if you can't be there, you've nominated somebody else to be there for the inspector. So again, for us to capture that information up front before we even get there. I think the challenge is often when we might just turn up on a site, but take on notice in terms of making sure that we've reached out and spoken to an HSR.
All right, so this follows on from this question about HSR rights. There you go. Anyone want to take that one?
There are very clear anti-discriminatory laws within the OHS Act. If you believe, and probably Trades Hall will want to hear from this, but if you believe that your employment has been terminated because you are raising issues as an HSR, please contact us. We are more than happy to make inquiries and have a look at any workplace that might be doing that. So if you've got any, if you personally, or if you've got any evidence that that's actually occurred, that you've actually been pushed out of your role or a company due to raising issues as an HSR, we would have serious concerns, and that would be a breach of the OHS Act.
Yeah, it'd be a breach of the Act. Claire is dead right. Your union should know about that straight away. We'd be curious to know about that at Trades Hall. Your union might want to bring sort of an adverse action claim up against that that employer. But yeah, we want to know about it straight away. And it's probably media worthy as well. Like, that's a pretty horrible thing to do. You know, someone who's just going about their job getting targeted like that. I know HSRs get targeted, but pushed out of the job, that's unacceptable. Sorry? Of course they should go back to their same job. Yep.
So this is a question around communication between an HSR and management. I might get you, Claire, to talk about what the obligations are, and then maybe down the end there, Daniel, you want to talk about what your experience of dealing with management and their understanding of OH&S issues are.
It's absolutely an obligation on an employer to make sure that their managers, well actually all employees, should be trained in health and safety. There's clear obligations under the Act and in the law in Victoria around the obligation of an employer to make sure management is absolutely trained in what workers' rights are and what their responsibility is in terms of creating healthy and safe workplaces. So if there is no management training, or you're concerned again that the employer actually does not understand their obligations and is challenging you around, I don't have to do that, or you can't tell me what to do, or I don't think that's a risk for whatever reason, again, you can contact us. I think Kim's details that I put up there before would be really useful as a first point, but again, that is something that if it's ongoing or of serious concern in terms of an employer not responding to risks and hazards, then we more than likely would send an inspector out. As I said earlier, our role absolutely is to enforce the law, but our role is also to provide support and guidance and also educate employers. If you're in an industry where there are members of their industry group, and there's a number of employer industry groups, they provide quite a lot of training around OHS obligations and support what workplaces should be doing. So it is an obligation.
Yeah, I've had plenty of disputes with management at work over OHS issues, and they've all been issues that management know quite well. They're knowledgeable in that sort of thing. But as I said before, it sometimes takes a bit of push to make them see eye to eye, because they've always got someone above them, and it's always production and profit comes first. Always, it's always money. Money comes before health and safety, and it always takes an argument and a shit fight and then a pin notice and to get to where you want to be, basically.
I reckon the best argument you can have sometimes, Daniel, when you have that is the cost of not doing the right thing.
Yeah, that's right. Work
So if you
cover
want to
costs.
talk money, yeah, that's
Work
right.
cover.
Premiums, the employer reputation, penalties, fines, prosecutions.
Us shutting down the factory.
So if, you,
Yeah.
so if you've got a boss that's not prepared to put in the investment to keep you safe, then they're actually taking a huge risk in terms of the cost of not doing that. So I think, you know, when they start to throw money at you, absolutely you can throw costs back.
That's right.
So here's one that pops up occasionally when we ask questions. Can management appoint someone to be a combined HSR management rep? Anyone want to take that one?
Anyone from the audience want to take this one?
Again, I mean, you probably highlighted there is a process to appoint HSRs in the Act, and so yes, if your employer is not adhering to the appointment of HSRs, again, please reach out to Kim or to Trades Hall around getting some advice around what you can do.
Have executives ever got together and have their own like designated work group?
Not in my workplace.
Anyway,
Yeah, not in my workplace.
the answer's no. No, you can't do that.
So if an HSR does issue a cease work and the employer ignores it, what happens then? And also, is it only the HSR that can remove a cease work?
No, we sometimes, if there is a dispute over a cease work or a PIN, often an inspector will be called out to either confirm or to turn over what you've issued in a workplace. Again, over the years that I've been coming here, a lot of the criticism that we've received, and I'm hoping we're doing better on, is often we'll overturn PIN or remove a PIN because of technical, like how it's been written. So we are doing some work with our inspectorate around, that's fine, but then stay with the HSR whilst they issue it, or we should issue the improvement notice if we have a concern around the safety of workers, not just to say where the PIN's not issued correctly and leave. If there's a contravention under the Act, and it is absolutely the mantra at WorkSafe, if there is a contravention under the Act, our inspectors cannot ignore it. And so we have got that feedback loud and clear, and we have given that feedback to our people to actually either they should issue the notice or work with the HSR to rectify the notice.
And if the cease work has been given because your trained HSR delegate says this worksite is dangerous, follow their advice. Seek work, then call your union.
I've always whenever I've issued a cease work, I've always stopped the line myself. I've walked along the line and called the workers off the job. That particular time before that I mentioned with the sterilisers, the company actually put me on a speakerphone to a legal advisor who recommended me to send the people back to work. And I told him, I said, look, with all due respect, you're acting on the company's behalf. It's not safe to send them back anyway, and we won't be attending the worksite until WorkSafe have been here or they've fixed the problem, whichever comes first.
And that can take courage, right? Because the boss wants to threaten you. That takes courage.
Okay. Really does.
So this one comes up fairly frequently as well. So I'm injured at work. Can the company make me go to their doctor, or can I go and see my own?
You do not have to go and see the doctor of the employer. It's your right to choose your medical practitioner. We know that some workplaces or some employers do have doctors or physios, depending on the industry. It might be hard for you to get access to a doctor quickly, and they might want you to get access quickly, so they might encourage that. But ultimately, it is your choice in terms of the treating health practitioner that you see.
Would anyone here want to go see the company doctor? No. Okay. Don't go see the company doctor.
So this one is, I think you'll have the answer to this one, Claire. I think this is a perennial thing around having inspectors who have experience in industries, particularly like construction, which has very particular OH&S risks.
Yes, so we, when I came into the role, we reformed our construction unit in our inspectorate, and the government has announced 40 more construction inspectors over the next 4 years. So we've just recruited 10 more, so each year an extra 10 construction inspectors. We've also put in place, because of all the major infrastructure occurring across the state, we've also increased our specialist inspectors in that team as well. So we've created a team to oversight the major infrastructure. All of our inspectors have on-the-ground experience, and some of them obviously, as I said, are engineers in craning or, concrete. So we do look at making sure we have that cross-section too, that when they go onto a site, that they're actually up to date with some of the latest ways in terms of the construction industry. So we are recruiting every year. So please, if you've got construction experience and you want to be an inspector, it's pretty competitive, I have to say. The last time we went to our recruitment, we had over 1,000 applications to be an inspector. So, but a number of people at this group told me it's their 4th time applying and they've finally got the gig. Kept doing lots of training and work, and so, as I said, we are looking at 10 new construction inspectors year on year for the next 4 years.
And that makes sense, because the amount of construction work we're doing across Victoria is more than I think we've ever done before. Keeping pace with that to make sure those sites are safe is already difficult. Like we are, when we look at deaths on site, this is the second most dangerous industry right now outside of agriculture. So this is a good step forward. But we want to make sure that those inspectors are given the skills to make sure that what they're looking at, that they can enforce their safety properly. So upskilling and getting the right candidates is super important.
Claire, you'll potentially have a view about whether WorkSafe can come out and help run an HSR election if people are afraid, and I suspect Luke and Daniel will have a view about the role the union might play in a situation like that.
Yeah, if your employer, if you don't want to talk to your employer about why they don't have HSRs or why they have not instituted a proper election process, again, ring Kim. So I'll send Kim's details out again, as I said, put up there before, because that is the first point around just seeing if we can get some support. But if the employer is just refusing, again, that is a breach, and so an inspector can come out and have a conversation in that workplace around ensuring that the employer does have HSRs in place, they understand the process that they have to undertake. We do have some guidance on that, and of course you've just received a copy of the Act and where that is stipulated in the Act. So if you do have someone that's not adhering to that, please give us a call. And the union probably is a bit the same, I would say.
Definitely the union. My union's been a great support of health and safety over the years. Also conducting elections and things like that. As long as somebody's prepared to stand and be elected, it's certainly a job for the union to call them out, and they'll bring you all the books you need and the Act and all that sort of thing, compliance codes, and that's definitely the way to go about it.
Okay. So I have a question which sort of follows on, which is, if you're an HSR and you see that someone is bullying and you know that that's an OH&S risk, what can we do as HSRs where people are afraid?
Yeah, it's a really tough one, I think, in terms of if it's the boss, basically, that's the bully. I think, obviously you can contact us, but again, that can be challenging. Our goal would be that you would have a workplace environment where you might have a conversation maybe about what are the behaviours that are okay in this workplace. Kind of seems obvious, but we know bullying continues to occur across the state. If it's a manager and then there's someone more senior, if you can go one up, sometimes that can help. If you've got a workplace where you've got a HR function, sometimes that can help. If you're discriminated, again, because you're raising health and safety issues, or that you're in fear of losing your job over raising health and safety issues, then I would suggest that you might want to give us a call around how to approach that and how we might be able to support you better to be able to have that conversation in your workplace.
There are laws about bullying in the state of Victoria, but the first thing, if I was the organiser and one of you members approached me about it, the first thing I'd be asking that person to do is starting keeping a record. You need to keep a record of that behaviour. We need to know it's unwanted. We need to know it's happening multiple times. And my lean-to would be I'd want a collective response to that manager. I wouldn't, that's where we've got our strongest position. You wouldn't want the employee on their own just to go out and have a crack so the manager can try to line them up. This is where a workforce needs to collectively come at that and take action. This is a good role for an organiser to play in helping assemble those people, and for that organiser to also front that meeting. But if that manager is bullying employees, it requires a collective response. But you want to make sure that you've got, you've written down that on these 4 or 5 occasions, this is what this manager is up to.
I've actually been there before where I've gone up and spoken to the manager myself. We've got an incident report file in the computer. It used to be on paper years ago when I started there, but it's on the computer now. And you can report an incident, an accident, an injury, a near miss, and I've always reported them there, to be honest. But it can be hard for some employees to do that. But they've come to me and I've made a report, and it has even led to warnings being issued to managers. So.
That's a great advice. Make it an incident report.
So this is just a question around whether HSRs, at a site where it's covered by the Comcare system, whether the HSRs have the same rights as they do.
Yes, I'm not acutely aware of the model law. I would imagine that they do, but they do come under the model laws where I'm referencing. Victoria still has our own OHS laws in Victoria, but I would be surprised if HSRs did not have the same rights under the model laws. But I apologise, I'm not across the detail of the model laws when it comes to HSRs.
There are problems when it comes to like REO entry. So we've had on multiple occasions where there's a Commonwealth site saying, or a company is, national and come under Comcare, where they've pushed back and said, look, we can't let your organiser or your REO train permit in. We think the Comcare laws do have problems compared to Victoria. And if your company is thinking of heading that direction, you should talk to your union quick smart about it, because that's not something we want.
That sounds potentially like an Ask Renata question, because I tell you who'll be absolutely on top of all of those details. So here's one around this conference. So is there a way that someone can encourage other HSRs coming because the other HSRs aren't particularly interested in it?
Can be a hard one if they're sort of not willing to come, but I'd certainly...
Free lunch?
Yeah, free lunch.
No.
A paid day, the employer has to pay for it. That's certainly something that would get them here, but there's a lot of people to speak to here. There's a lot of advice that you hear from people up on the bench. And if you're a new HSR, there's certainly a lot here to learn too.
Look, I think it's a terrific opportunity. Like, the boss pays for you to come here and talk to other people who might face other health and safety issues in your industry, and you get a whole day to try to nut some things out. You might hear from all of us, and that might not be the most entertaining part of your day, but if you don't take this opportunity to refresh yourself with the Act, refresh yourself with people who are taking action, and just to get some tips, hints and advice about what's next, I think you're mad not to be here. This has got 1,700 people who are attending both here and in regional Victoria, and well done to everyone in regional Victoria. Like, you guys are going great guns, growing. But this is a super important conference, and I don't think it happens anywhere else in the world. Like, this was won by all of you, fought for. It was dismantled by the Conservative government because they don't want us here. They don't want us talking health and safety and organising. This is a precious opportunity. So I'm rapt that you're all here, and that person, give me their phone number, I'll give them a call. Tell them to come along, all right?
Yeah, I was going to say, just on that, I think you do have to invest not only in your education, but actually building your network. Even just listening to Daniel today, his advice is different to my advice, is different to Luke's advice, because we all are coming from it from a different place. You all have information, experience and lessons that's actually going to help each of you when you go back into your workplace. So if you're not doing that, then I'd actually argue that you're not really invested on how to improve health and safety. So again, I think how do you encourage people is you talk about the experience, you see all the information that you've got and you're taking back to the workplace, and it's an investment in your education and opportunity to make sure you can go back in and do the role that you're being tasked to do as an HSR. So I think it's pretty important.
All right, so speaking of free lunch and free, the food that comes with attending here today, it's now time for us to break for morning tea. So I want you to thank our three speakers up here today.
Thank you.